an Achilles tendon injury can be easily misdiagnosed because some providers may feel that this may be an ankle sprain from where a patient rolled their ankle. But to easily pick up an Achilles tendon rupture, you have to actually feel the back of the Achilles itself to feel a step off in the tendon. You actually can squeeze the calf muscle and see if the foot moves, and it's called a Thompson's test. When a patient is seen in the emergency room, you really have to talk to them about where their pain is located instead of just how did it occur. And you have to go over the entire ankle itself with manual palpation to see where the pain is located. For Achilles tendon injuries, either partial or partly torn, they could be treated with or without surgery depending on the severity of the tear. You would need an MRI to evaluate the severity of the tear to see if surgery or no surgery would be the best treatment for you. For instances when the Achilles can be treated non-operatively, a patient will be placed in a boot with a wedge to offload the tendon to allow it to heal. Patients may be required to be non-weight bearing during that time frame, or they may be allowed to partially weight bear while it heals. If you are experiencing Achilles pain, please contact our office so that we can evaluate you and determine what the true cause of your heel pain is, and then we can develop a treatment plan for you.